So, energy psychology is using energy methods to change psychological issues like phobias, depression, anxiety, and traumatic stress. And rather than using conscious methods like talk therapy, and talk therapy is wonderful in its place. But when you use energy, you can often shift people really, really quickly. Like I worked with somebody a couple of weeks ago, and this woman had a lifetime pattern of low self-esteem. So she's got a whole history for the previous 40 years of her life of low self-esteem. And we use energy psychology to work on that, not working cognitively, not working at the level of the mind, purely working at the level of our energy system, which we did using acupressure. And so we just applied acupressure to some points while she was reflecting on a key event. The key event was that when she was born in the late 1970s, when she was born, at that time, there was no way of determining the gender of the child before birth. So the baby popped out, and the nurse said, "It's a boy, it's a girl." And so the baby popped out, and the nurse said, "It's a girl." And her father said, "Ah, I wanted a boy." And even
Mhm.
though this was a birth memory, it was a memory far below the level of the conscious mind. This had led to her feeling unwanted, a mistake, rejected, not worthy, her entire life. So here, this one critical moment in her life is affecting her whole subsequent life. How do you tackle that cognitively? The mind hadn't developed to the point even of language. So how do you deal with this? We used energy psychology. We used acupressure. We used breathing. We used eye movements from EMDR. And we did about a 20-minute session. And after that, her level of triggering around this went away completely. And she said, "I accept myself just the way I am." That's the miracle of energy work. You don't have to develop a long explanation around it. You don't have to do a ton of therapy around it. You just use energy interventions. And when you shift your body's energy, what happens is that the way the brain processes information changes. When people think about, for example, and we've done, again, work with over 20,000 veterans over the last 15 years. And when, say, a veteran is thinking about an event. Like one veteran I worked with, he had to clean the helmet of his friend who had been shot by a sniper and died. And he pulled the job of cleaning up this friend's uniform, sent it back to his next of kin in the USA. And it was just a terrible job and unbelievably emotionally triggering. It was the worst day of his life. And so we worked on that, but again, we used these energy techniques. And very, very, very quickly, he was able to bring his triggering down to see the event very differently. So when you apply these energy techniques, even to serious trauma, it shifts the whole way we see it without the need for a lot of mental processing. So energy is effective. Is talk therapy useful? Absolutely. There are many components of our lives where talk therapy is incredibly useful. And a lot of therapists work with both of those techniques, both energy and the cognitive capacities of the brain. But it can shift even these tragic events really, really, really fast. And again, it's using things like eye movements, tapping on various points, or rubbing various points of the body, stimulating various parts of the energy system. When people are thinking about and reflecting on a traumatic memory, their emotional midbrain is highly aroused. On an EEG, we see it turn red with arousal. What happens is that as they tap, we see the EEG change, and it goes back to baseline. It becomes green. It goes back to normal function within a few minutes, usually, even if it's serious trauma. So it's not only using energy to affect healing, it's also visible in energy measurement instruments like MRIs and EEGs, EKGs, ECGs. So it's using energy to produce healing. It's really quick. It's effective for most things. It's not a panacea. It isn't equally effective for everything, but it does produce healing. What happens when we use this for trauma clearing is that those events, those deficits that have been occupying our minds, that have been capturing our attention, that have been commanding our awareness over and over and over again. We try and do better, and we don't. We keep thinking the negative thought. Our minds keep returning to the threat, the bad thing. When we break that cycle, which we can do very quickly with energy psychology, it tends to stay broken. When we bring veterans into our veteran stress solution program, and we've done several clinical trials of these veterans, they have high levels of PTSD, flashbacks, nightmares, intrusive thoughts, dysfunctional cognitions, all these deficits. And on the scale that the VA uses to score them, they're way above the clinical level. They have extremely high levels of PTSD. After treatment, those levels drop by about 2/3 and they enter the normal range. When we test them again, they are still in the normal range 3 months, 6 months, 12 months, 24 months later. When you break that association between a traumatic thought and going to the stress response, fight or flight, one time, it often stays broken. And that's the way you then release that backlog of stress, whether it's from your childhood or from adult traumas. And if you do enough of this, then that's gone. You then can start to have these non-local experiences. You can meditate, you can get places without your brain returning over and over and over again involuntarily to focusing on threat. So that's what energy psychology is. That's why it works. That's why it's effective for trauma, and why it's an important part of a spiritual practice. Because if you try and go to the mountaintop without healing all the garbage in the basement, the garbage in the basement's gonna come and get you. And you look at Buddhism and the scandals we've had there in the last 15 years, and Christianity, and look at, John of God and pedophile priests and all these scandals that have roiled various religions, and none of them is exempt. Judaism, Hinduism, they all have these people who are having pinnacle experiences, maybe great spiritual teachers. If they haven't gone and cleaned out the basement, that festering mass, the dark side, the shadow self, is going to reach up there through the trapdoors and start to really mess things up in terms of the outside world and your experience. So the two things go hand in hand. When I was a teenager, I joined a spiritual group, and the teaching was, we transcend. We've all got this childhood trauma, but all we do is we go live at these elevated places in consciousness. That becomes the new self, our new identity, and the old self disappears. Not. Research shows you have to go and heal trauma. You cannot transcend it. That's spiritual bypassing. It just doesn't work, and there's ample evidence that it doesn't work. So you absolutely have to go there and heal those wounds as well as having those elevated experiences.